Introduction. Ischemic pain is pain caused by decreased blood supply to a region in the body or a certain organ, like the leg or heart. The affected tissue does not get enough oxygen and nutrients, and the pain is a warning sign that cells are in trouble. If the ischemia persists, the patient can develop widespread cell death and may experience complications, like ulcerations along a leg with inadequate blood supply. Treatments are available for the management of ischemic pain. The sensations associated with ischemic pain can vary, but they tend to be very intense. The pain may be sharp, stabbing, or biting. Patients usually feel a sense of tightness and burning. They may attempt to move only to find that the pain becomes more intense and the muscles can spasm. Some ischemic pain can become unbearable for the patient and may be recurrent, leading to chronic pain and irritation. One common example of ischemic pain is angina, a condition where diseased coronary arteries do not supply enough blood to the heart, and the patient periodically experiences tightness and burning. Some patients only develop angina during vigorous exercise, while others can experience it at any time. Medications are available to treat angina both during attacks and in the long-term prevention of future episodes. Patients may need to undergo some testing to confirm that the cause of the pain really is angina. Another frequent location for ischemic pain is in the leg. This can be common in patients with circulatory disease. They will notice burning sensations and intense pain. Over time, gangrene can develop as cells die, skin sloughs off, and inflammation sets in. This may lead to the need for an amputation to remove the dead and diseased tissue. Especially when the circulatory disease includes neurological impairments, the patient may not be aware of the extent and severity of the pain and injuries to the leg, and thus does not immediately realize that there is an ischemic injury. Treatments for ischemic pain can include medications to improve circulation, along with lifestyle changes, like exercise to work the involved area of the body, or an improved diet. Surgery may be necessary to treat vascular disorders. Often the patient has an underlying issue like diabetes that contributes to the ischemic pain, and controlling that medical problem may resolve the pain as well. Monitoring for signs of recurrence or evidence that the treatment is not effective will help a doctor intervene quickly if the patient does not respond well to treatment. Ischemic rest pain in obliterative arterial disease of the lower extremity is as informative diagnostically as is intermittent claudication. Specifically, ischemic rest pain is pain that occurs in the toes or in the area of the metatarsal heads. Occasionally, it occurs in the foot proximal to the metatarsal heads. Elevation of the limb above or at the horizontal position aggravates the pain, and pendency, to some degree at least, brings relief. We have taught that no other pain is to be considered ischemic rest pain. Muscle cramps, for example, or any type of pain in the leg or thigh, no matter when it occurs, is not rest pain. We have, however, recognized one variant, and that is numbness of the toes brought on by the horizontal position and relieved by pendency. Our homespun explanation of ischemic rest pain to our students has been that the effective pressure is not sufficient. 3 diseases are characterized by ischemic pain: angina, intermittent claudication, and sickle cell anemia. Angina is the chest pain caused by coronary vascular disease, and intermittent claudication the pain caused by peripheral vascular disease. Misshapen red blood cells can block blood flow in sickle cell anemia, causing severe, unpredictable bouts of pain. Ischemic pain feels distinctly different from other forms of pain, such as tissue damage, burning, or inflammation. The sensation can be experienced simply by running or swimming at a sprint for about 40 or 50 seconds. The severity of the muscle pain will stop you from proceeding further. It is this sensation that appears unexpectedly in sickle cell or angina patients, or upon mild exercise, such as walking, in a patient with intermittent claudication. Middle-distance athletes and thoroughbred racehorses train to maximize the time they can sprint before being stopped by muscle ischemia. The most important fact about ischemic pain was demonstrated in experiments performed in the 1930s. Blocking blood flow to an arm with a tourniquet does not of itself cause pain, but if it is accompanied by mild forearm exercise, striking ischemic pain ensues. The conclusion is that the pain is caused by release of one or more compounds from working muscle that accumulates when there is insufficient blood flow and then act upon certain nociceptive sensory neurons that innervate the muscle. Advances in the management of ischemic pain. Ischemic pain is pain caused by obstruction of the circulation to a body part. Pain management centers have only recently become involved in the care of patients with ischemic diseases such as peripheral vascular disease and angina pectoris, because now these centers have something unique to offer. This chapter provides a review of the pathophysiology of ischemic disease, the therapies available and their efficacy, and the role of the pain specialist in the management of patients with peripheral and coronary ischemic disease. Atherosclerosis obliterans is the principal cause of ischemic pain associated with peripheral vascular disease and coronary artery disease. Ischemic pain in peripheral vascular disease is insidious and gradual in onset. It usually begins with intermittent claudication. Most patients have atherosclerotic changes for 5 to 10 years before they have symptoms. Approximately 25% of patients with intermittent claudication will progress to critical ischemia and pain at rest. Intermittent claudication is the earliest sign of vascular insufficiency, which is characterized by cramping, tightness, and heaviness that increases with exercise. The pain is relieved with rest, and the claudication distance remains fairly constant until further progression of the disease. In the early stages of the disease, collateral circulation develops and may maintain adequate perfusion to the affected limb, but may not provide sufficient blood flow to prevent symptoms, especially during exercise. Over time, both the primary and collateral vessels become stenotic or occluded, and critical ischemia develops with pain at rest. The most common sites of atherosclerosis obliterans are the femoropopliteal arterial segment and the aortoiliac vessels, causing pain in the calves and buttocks, respectively. With the progression of the disease, gangrene, ischemic ulcers, and trophic changes can occur in the more distal locations, namely the distal foot and toes. Ischemic ulcers can occur spontaneously. However, trauma is usually the inciting event leading to ulcer formation. The injury is unable to heal due to poor perfusion. Trophic changes, specifically dry, scaly skin, loss of hair, and thick nails, are also a sign of arterial insufficiency. Conservative therapy for treatment of intermittent claudication includes smoking cessation and the control of contributing diseases such as hypertension, diabetes, and hyperlipidemia. Protective and prophylactic care of the feet, including good hygiene, avoidance of trauma, pressure points, and poorly fitting shoes, is imperative to prevent ischemic ulceration and gangrene. Keeping the feet clean, dry, and free of infection is also important. In spite of these measures to slow the progression of atherosclerotic occlusive disease, 25 to 50% of patients will require more aggressive treatment. Ischemic pain is described as an achy and crampy sensation that is worse at night and improves when the legs are in a dependent position, which improves blood flow. When rest pain occurs, the degree of vascular insufficiency is severe, and these patients are also at increased risk for diffuse atherosclerotic disease of the coronary and cerebral arteries. Chapter 2. Treatment of ischemic heart disease. Two of the most common indications of cardiovascular disease are angina pectoris, chest pain, and myocardial infarction, heart attack. The pain felt in angina pectoris occurs because blocked arteries prevent an adequate supply of oxygen and nutrients from reaching the heart. The main causes of stable angina are increased physical effort, emotional stress, exposure to secondhand smoke, or even by certain meals or weather changes. Unstable angina can occur during rest or even while sleeping, and is often considered to be an intermediate condition between stable angina and a full-blown heart attack. Angina is treated medically with nitroglycerin, beta blockers, or calcium entry blockers. It seems that cardiovascular disease doesn't appear at other mammals. Scientists think that the cause is our inability to produce vitamin C. The lack of vitamin C is an important factor of risk of heart disease. Vitamin C helps to strengthen the artery walls by building up the collagen content. There are two types of treatment of cardiovascular disease: conventional treatment, which employs surgery and drugs to treat the symptoms of cardiovascular disease but rarely gets to the root cause of the disease. Alternative treatment, which bolsters the body's innate healing powers and focus on removing the cause of the disease rather than on treating its symptoms. The most useful non-invasive tests for diagnosing early heart disease are electrocardiogram taken while resting and during exercise, which measures electrical activity of the heart. Radioisotope studies, which are very useful in spotting inadequate blood flow in and around the heart. Echocardiography, which is used for evaluating the heart's performance. Other non-invasive procedures include positron emission tomography, PET scanning, CT scanning, and magnetic resonance spectroscopy. The alternative treatment aimed at containing and reversing the underlying cause of cardiovascular disease. It's easier to prevent than to treat. Diet and lifestyle changes are perhaps the most tools in the natural treatment of cardiovascular disease. Doctors recommend a diet devoid of animal products, except egg whites and non-fat dairy products, and very low in fats and cholesterol, giving up smoking, and a program of moderate exercise. Risk factors of ischemic heart disease. Ischemic heart disease, we can include people with personal or family history of heart attack, myocardial infarction, when a part of heart muscle is permanently damaged or actually dies because there's not enough oxygen. Unstable angina is an intermediary between myocardial infarction and stable angina. Its manifestation is a severe chest pain that lasts more than stable angina, and it doesn't respond very well to medication. Angina is a chest discomfort which occurs when the coronary vessels receive an inadequate blood flow. Atherosclerosis occurs when fatty material deposits into the artery's walls. This can lead to a blockage of the arteries. Other risk factors of ischemic heart disease are hypertension, high blood pressure. Blood pressure can vary with activity and with age, but a healthy adult who is resting generally has a systolic pressure reading between 120 and 130, and a diastolic pressure reading between 80 and 90 or below. Diabetes. Heart problems are the leading cause of death among people with diabetes, especially in the case of non-insulin dependent diabetes, also known as type 2 diabetes. High blood cholesterol. Cholesterol is a fat-like substance carried in your blood. It can be found in all of your body's cells. The liver produces all of the cholesterol your body needs to form cell membranes and to make certain hormones. Extra cholesterol enters your body when you eat foods that come from animals, meats, eggs, and other similar products. Obesity and overweight. Extra weight leads to increased total cholesterol levels, high blood pressure, and an increased risk of coronary artery disease. Obesity increases your chances of developing other risk factors for heart disease, especially high blood pressure, high blood cholesterol, and diabetes. Smoking. It's well known that smoking increases the risk of lung cancer, but few people know that it also increases the risk of heart disease and peripheral vascular disease, disease in the vessels that supply blood to the arms and legs. Smoking also raises blood pressure, which increases the risk of stroke in people who already have high blood pressure. Birth control pills. At the beginning, birth control pills contained high levels of estrogen and progestin, and taking these pills increased the chances of heart disease and stroke, especially in women older than 35 who smoked. In our days, the dose of hormones contained in these pills has been lowered, and they are considered safe for women younger than 35 who do not smoke or have high blood pressure. Physical inactivity. People who exercise regularly have a lower risk of heart attack than people who are not active. Exercise burns calories, may lower blood pressure, and helps to control cholesterol levels and diabetes. In addition to this, exercise makes the arteries more flexible and strengthens the heart muscle. Symptoms of ischemic heart disease. Why is it that the symptoms of heart disease in women are oftentimes difficult to quantify? The very nature of heart disease in women has yet to be fully understood. Perhaps assigning it a proper name will help. It's called ischemic heart disease, also known as cardiac syndrome X, also known as microvascular coronary disease. Confused yet? You are not alone. As it turns out, some in the medical profession are hard-pressed to diagnose a woman with IHD because of the greater symptom burden. Your symptoms need to show heart disease, which, as some of us may have experienced firsthand, isn't always easy to do. What's worse is the startling disparity in the heart care women receive in comparison to men. So what's a girl to do? Know your symptoms. While it is true that some have experienced pressure and/or pain in the chest, other subtler symptoms often present themselves as well. Included in these may be pain in the shoulder, neck, or jaw, back pain, shortness of breath, palpitations, extremely fatigued, a feeling of fullness in the area above the stomach with loss of appetite or nausea, heart rate fluctuation, either too fast or too slow, lightheadedness, dizziness, sweating, and a sense that something is very wrong. Additionally, at least in my case, these symptoms would come on without warning. In fact, they would occur more often than not when I was at rest. Should you be experiencing these or any other symptoms you believe to be associated with your heart, contact your physician immediately. Don't rule out a trip to the ER if necessary. What is ischemic colitis? Ischemic colitis is a colon condition that occurs when a section of the colon is not getting the blood supply it needs. As a result, it grows larger than it should and becomes inflamed. It is called ischemic colitis because the word ischemia is a medical term that's used when there's a blockage in a blood vessel. The word ischemia is also used to describe coronary arteries when blood flow around the heart is obstructed by plaque. This, of course, is the main reason for a heart attack. Ischemic colitis generally occurs on the left side of the colon, but blockages may occur anywhere. Happily, it is often mild and goes away in a few days, whether it is treated or not. Chronic cases are possible, however. Sometimes the condition becomes so severe that permanent damage to the colon can result. Ischemic colitis happens for several reasons. Colon cancer is the most serious of these. Atherosclerosis is another. Atherosclerosis is a buildup of fatty deposits on blood vessel walls. Blood therefore has less room to flow to organs and tissues, which can lead to cell death and tissue destruction. Atherosclerosis is often the cause of chronic ischemic colitis. Blood clots account for some cases too. Ischemic colitis can take place in conjunction with several other disorders, including hernia and diabetes. Certain medications can also trigger the condition, but this is rare. When it does happen, NSAIDs, non-steroidal anti-inflammatory drugs, estrogen replacement medications, and migraine relievers are generally the cause. Antipsychotic medications and blood pressure medications are other possibilities. Abnormal surgery sometimes results in temporary ischemic colitis, as do infections involving certain kinds of bacteria. The most frequent and obvious symptom is abdominal pain that can appear either gradually or suddenly. Pain in the upper abdomen after a meal could be a symptom of gallbladder problems, but it also could be ischemic colitis. Abdominal discomfort is often accompanied by nausea, vomiting, and a slight fever. Some symptoms are downright unpleasant and can certainly be disconcerting or even frightening. These symptoms include diarrhea and a frequent, powerful urge to move your bowels. Blood often appears in the stool, and individuals with this disorder may even pass blood without stools. As mentioned above, pain and discomfort usually occur on the left side of the colon. If you start feeling discomfort on the right side, it could mean there's a blockage in blood flow to the intestines. Such blockages can be serious and should not be taken lightly due to the possibility of tissue death. This can cause a medical emergency that requires surgery, making it important to get to a doctor right away. What is ischemic heart disease? Are you at risk? The obstruction results from cholesterol deposits sticking to the artery wall, interrupting the flow of blood to the heart. The deposits harden, causing hardening of the arteries. This is called atherosclerosis, which is a medical term sometimes interchanged with arteriosclerosis. Both have the same effect, whereby both impede blood flow to the heart. Arteriosclerosis or plaque buildup is a common factor in ischemic heart disease. Plaque, a result of high cholesterol and triglyceride levels, builds up in the vessels that feed the heart, causing blockage to occur. This interferes with blood flow to the heart and terminates in heart attack symptoms to occur. The patient may exhibit signs ranging from shortness of breath to irregular heartbeats and chest pain. Sometimes there are no symptoms due to damage to the nerves that surround the heart due to heart disease. As time passes, plaque deposits narrow the arteries, causing inefficient blood flow, which can also lead to the development of a type of ischemic heart disease called angina. Angina pectoris, or strangling, is chest pain caused by lack of oxygen to the heart due to poor blood supply. This puts the patient at extremely high risk for heart attack and cardiac arrhythmia. People who are at risk for ischemic heart problems most likely have a family history of heart disease, high blood pressure, or diabetes. The risk in most instances can be alleviated or eliminated altogether by drastic changes in lifestyle, such as losing weight and stopping smoking. While these changes may reduce risks, they do not necessarily cure ischemic heart problems that is already present. If the person has had a previous heart attack, they have an increased chance for having another heart attack within 5 years. Regular visits with your physician to monitor for any changes in the patient's condition will alert the physician to any potential problems that may crop up and slow down the rate of disease progression. The good news about ischemic heart disease is it can be prevented, or at least lessen its severity. The answer is simple but may not be easy to implement. It's not easy to change the way we have been doing things for the past 20 to 30 years, but when you think of the alternative, change can be a good thing. Ischemic optic neuropathy, Ayurvedic herbal treatment. Ischemic optic neuropathy, ION, relates to sudden vision loss which can be complete or partial and resulting from an interrupted blood supply to the optic nerve. This condition can be either anterior or posterior. The anterior type is more common and relates to disease confined to the retina and the adjacent part of the optic nerve. Posterior ischemic optic neuropathy relates to pathology which can affect the distal part of the optic nerve, usually a distance away from the eyeball. Anterior ischemic optic neuropathy can be classified into two types, arteritis and non-arteritis. Inflammation of arteries, usually associated with giant cell arteritis, from the arteritis type of AION, which is more common in women, especially over the age of 55. Generalized symptoms are usually associated with this condition and include fever, fatigue, body ache, and localized pain. The condition usually starts with a temporary blurring of vision, after which gradual permanent vision loss occurs. Fluorescein angiography can be used to diagnose this condition, which is usually treated with steroids in order to protect the unaffected eye. The non-arteritis type of ischemic optic neuropathy is more common than the arteritis type and is usually seen in both sexes. A sudden reduction in blood pressure causes reduced blood flow to the optic nerve, causing this type of optic neuropathy. Medical conditions which can cause this include diabetes mellitus, rheumatoid arthritis, herpes zoster, anemia, sickle cell disease, sudden high or low changes in blood pressure, gastrointestinal ulcers, heart disease, vasculitis, and migraine. The presentation of non-arteritis AION is characterized by a sudden, painless vision loss in one eye, usually noticed on waking up from sleep. Underlying cardiovascular disease usually needs to be treated aggressively while managing this condition. Ayurvedic herbal treatment from ischemic optic neuropathy depends upon the known cause of the condition. Inflammation of arteries can cause swelling within the lumen of the arteries, leading to a blockage and interrupted blood supply, thereby causing partial or permanent damage to the retina and optic nerve. Ayurvedic herbal medicines, which have a strong anti-inflammatory action and which also have a specific affinity for arteries and capillaries, are used in the management of the arteritis type AION, in conjunction with medicines which have a specific affinity for the eyes. In addition, medicines are also given to remove toxic components from inflamed arteries so as to normalize the circulation, provide nutrients to the damaged retina and optic nerve, and reverse the damage to the maximum extent possible. Other associated conditions of the non-arteritis type of AION also need to be treated symptomatically. Depending upon the severity of the condition, ION needs to be treated with herbal medicines for periods ranging from 6 to 9 months, or possibly even longer, in order to provide the maximum possible benefit and stabilize and improve vision to maximum extent possible. It is important to commence aggressive Ayurvedic treatment at the earliest in order to salvage optimum level of vision. Ayurvedic herbal treatment can play a significant role in the management, treatment, and possible cure of ischemic optic neuropathy. Chapter 3. Ischemic and Hemorrhagic Stroke. Hopefully you never had to endure a situation of someone close to you suffer from transient ischemic attack, TIA, also known as mini-stroke, or from a stroke. In any case, you should be familiar with both kinds of stroke as they both destroy brain tissue and can produce similar long-term effects. But there are important differences in what causes them and in the symptoms that tell you which kind of stroke is happening. Ischemic stroke. According to statistics, 80% of strokes belong to the ischemic stroke kind. These mini-strokes occur when blood flow to the brain is blocked by plaque-clogged arteries or by blood clots. This means that blood is not circulating properly inside the brain, causing brain cells to die even for a few minutes. No oxygen is transmitted to them via the blood. Symptoms: sudden numbness or weakness, especially on one side of the body, difficulty speaking or understanding speech, trouble seeing in one or both eyes, dizziness, and a sudden loss of balance, falling in and out of consciousness, chest pain, and shortness of breath. These last three are less brain-centered and are more commonly experienced by women. Hemorrhagic stroke. These brain hemorrhages happen when a blood vessel in the brain bursts, spilling blood into the surrounding tissue. There are various causes of these bursts. The most frequent is the rupture of an aneurysm, a weak spot on the wall of an artery that happens to be in your brain. Aneurysms can occur elsewhere in the body too. Experts point out that women are twice as likely as men to have an aneurysm in the brain and are more likely to have multiple aneurysms than men. Two other causes for bleeding in the brain are hypertension, which can create enough pressure to break an artery wall, and arteriovenous malformation, AVM, in the brain. This is a snarl of defective blood vessels and capillaries whose thin walls are prone to rupture. Symptoms: a sudden, violent headache, as if cracking a fault line through the brain's delicate architecture. The patient may also suffer from blurred vision or nausea. If you ever suspect you might be having a TIA or a stroke, or believe you are witnessing someone else having one, make sure 911 or your local emergency unit be called immediately. Tell the dispatcher that, if possible, you want to be transported to a hospital with a stroke center. Do not attempt to drive to the emergency room yourself. Stroke patients who arrive at the hospital by ambulance are evaluated sooner by an ER physician, get the necessary testing, and are admitted to the hospital or intensive care unit more frequently than those who arrive by taxi or car. Most importantly, bring someone prepared to advocate for you or the patient. Be prepared by being informed and act fast. Types of strokes: ischemic, intracerebral hemorrhage, and subarachnoid hemorrhage explained. There are several types of strokes that an individual may suffer from. A stroke occurs when there is a problem that directly affects the blood vessels that run to and from the brain in the central nervous system. Each stroke type has a different cause. While many medical professionals agree that there are many different types of strokes, it has been established that 3 types of strokes are more common than others. These 3 include the strokes that are identified as ischemic, intracerebral hemorrhage, and a hemorrhage identified as subarachnoid. In this medical guide, you will learn a little information about these types of strokes. Ischemic stroke. The ischemic stroke is considered to be the single most common stroke that individuals experience. As a matter of fact, approximately 80% of all diagnosed strokes classify as an ischemic stroke. This type of stroke happens when a particular artery that runs to the brain becomes blocked. The blood that travels to the brain is directly responsible for delivering important nutrients and oxygen directly to the brain. If a blockage occurs and the brain fails to receive these nutrients and oxygen, it is quite likely that the cells within the brain will completely die. Intracerebral hemorrhage. If an individual has a blood vessel in the brain that is diseased, it is likely that it will eventually burst. When this occurs, a stroke that is identified as an intracerebral hemorrhage is said to occur. The blood that emerges from the damaged vessel will then leak into the brain itself. As the leakage continues to occur, it is quite likely that the pressure will occur. Naturally, the brain will not respond well to the pressure that is being experienced. The cells that are part of the brain will start to die. Many individuals may become unconscious. This could prove to be a potentially fatal stroke. Out of all diagnosed strokes, this type is said to account for up to 12% that are experienced each year. Subarachnoid hemorrhage. This type of stroke results when one of the blood vessels that are on the outside of the brain experiences a rupture. The space that rests outside the skull that protects the brain immediately becomes filled with blood. This buildup of blood immediately causes pressure to the head area. Many patients will immediately experience a headache that is quite severe. Immediately following the intense pain in the head, pain may be experienced in the neck. There are many that will suffer from nausea and dizziness. Many patients may also experience vomiting that is quite severe. The people that suffer from this type of stroke may lead to varying degrees of consciousness and even death. If you or someone that you know suffers from symptoms associated with a stroke, it is important to seek medical attention immediately. Hypoxic ischemic encephalopathy. The medical condition known as hypoxic ischemic encephalopathy happens when the cells of the spinal cord and brain become damaged because of an inadequate supply of oxygen. If a child experiences this condition during, before, or just following childbirth, a type of medical malpractice on the part of the physician could be to blame. The condition of hypoxic ischemic encephalopathy occurs in between 2 to 4 out of every 1,000 births. The condition most commonly happens just before or during birth. When hypoxic ischemic encephalopathy does occur, the condition can become extremely serious and has the potential to cause permanent and possibly life-threatening damage to the brain. The statistics surrounding hypoxic ischemic encephalopathy are quite alarming and need to be taken very seriously. It has been found that 15 to 20% of all infants who have been diagnosed with the condition will die while still in the newborn stage. Of the infants with hypoxic ischemic encephalopathy who do survive, permanent neurological issues will be seen in at least 25%. The condition is one of the main causes of learning disabilities, mental retardation, cerebral palsy, and epilepsy. The process of childbirth is one that is quite important in a woman's life. It is during this process that a woman will find it is the only time when she will have a continual and extended contact with her medical professional. Since the process of giving birth is a natural thing, most people who are expecting a child expect that the process will go smoothly without complications or problems. Unfortunately, this is not always the case, and complications such as hypoxic ischemic encephalopathy can occur, leaving families devastated and filled with questions as to why the injury happened at all. The precise reasons why birth injuries, including hypoxic ischemic encephalopathy, happen are not entirely known. There is a great deal of debate in the medical community as to the exact cause of this particular condition and the possibility of whether it can or cannot be prevented and detected before injury occurs to the newborn. Some research data has found that material hypotension, umbilical cord complications, abruption, placentae, maternal uterine rupture, and other assorted complications can result in hypoxic ischemic encephalopathy. A child who is affected with this tissue can have various types of symptoms, including seizures and other signs of brain damage that are not specific. Since there can be a variety of reasons for birth injuries occurring, and because the condition of hypoxic ischemic encephalopathy is not completely understood, diagnosis can be difficult. In fact, this condition can be one of the hardest to properly diagnose because there are a number of issues that present similar symptoms. Even though the condition of hypoxic ischemic encephalopathy is not completely preventable in all cases, the main cause of this serious and often debilitating condition is due to medical negligence. This condition causes devastation to families in a number of ways. Expectant parents endure 9 months of prenatal care and take a number of precautions to ensure their baby is safe and healthy. Having any type of complication at birth that impacts an otherwise healthy fetus can be quite traumatic. Add to this the stress and worry of having a child that could be permanently disabled or even die because of a birth injury, and the end result is quite sad. If the child is able to survive the injury, parents often must watch their child suffer for a lifetime with debilitating symptoms such as painful seizures, mental retardation issues, and physical impairments. If all of the physical damage was not bad enough or hard enough to deal with, parents often feel a great deal of mental anguish because they never fully understand what happened or why their child suffered such a serious injury at birth. On top of all these issues, both physical and emotional, there is also usually a large financial toll because of the need for extensive medical treatments and therapies for children that survive. What is perhaps the most difficult issue to deal with is that the vast majority of cases of hypoxic ischemic encephalopathy could and should have been prevented. These injuries are often due to the negligence on the part of medical professionals, which is something that should not be dismissed. Doctors have a duty of care that is owed to all patients, and when this is breached in any way, especially in this serious of a manner, action needs to be taken. If your child has suffered with a birth injury such as hypoxic ischemic encephalopathy, and it was the result of a medical professional failing to take proper action or providing adequate treatment for a complication that arose, you need to understand that you have legal rights. Medical professionals can be held liable for the damage that has resulted. Your best course of action is to consult with a personal injury attorney who specializes in the area of medical malpractice and negligence. A personal injury attorney who specializes in this area of the law is extremely skilled with handling these types of cases and will manage every aspect of your claim from start to finish. He or she will review the details of your case, collect medical records, gather evidence, speak with witnesses, and even arrange for expert testimony if need be. Your attorney will be your very best line of defense when dealing with the teams of legal representatives placed on staff by doctors and hospitals. Since most personal injury attorneys work on a contingency basis, you do not have to worry about how to pay for your case as it progresses through the system. You pay nothing up front, and you do not have to pay until the time your case is settled. With so little to lose and so much to gain, there is no reason to risk missing out on the justice that you so rightly deserve for yourself and your entire family unit. Know your heart and its disease. There are a variety of ailments related to the heart, and providing information on all the types of cardiovascular disease could be quite a task. Yet a look at conditions that affect the heart and blood vessels can give you a broad view of cardiovascular disease. You hear many terms like coronary heart disease, atherosclerosis, or some other term, and you are left wondering as to what exactly all these terms mean. Medical information could confuse you. Triglyceride is simpler when mentioned as a fat in your body. It is essential that you read and stay informed on some basic terminology. You could watch a few programs related to the heart and its working before going to your doctor. The word give the meaning as well. Cardio is related to the heart and vascular is related to the blood vessels. Diseases of the heart are many. Some specific types are coronary artery disease. Arteries supply the heart muscle with blood. Obstructions in the artery is a condition called atherosclerosis, is a leading cause of coronary heart disease. Arteries supply the heart muscle with blood. Obstructions in the artery is a condition called atherosclerosis, is a leading cause of coronary heart disease. Coronary artery disease causes angina, chest pain, and myocardial infarction, heart attack. Coronary heart disease. Coronary heart disease is a more comprehensive term. It collectively refers to coronary artery disease and its disease that are a result of the coronary artery disease, like angina and myocardial infarction. Women and heart attack is another important aspect with the onset of menopause. Cardiomyopathy. This refers to all diseases of the heart muscle. It deals with loss of heart muscle, ischemic, enlargement of heart muscle, dilated, and thickening of the heart muscle, hypertrophic. Another type of cardiomyopathy is an enlarged heart without a known cause, idiopathic dilated cardiomyopathy. Valvular heart disease. The heart consists of valves that direct the flow of blood into and out of the heart. Diseases of the heart valves are due to conditions like narrowing of heart valves, stenosis, leaking of a heart valve, regurgitation, and if the closing of the valve is not proper, prolapse. Heart valves can also be damaged by other conditions: rheumatic fever, connective tissue disorders, medications or treatments for cancer and even infections, infectious endocarditis. Pericardial disease. Pericardium is a sac that encases the heart. This can get inflamed, pericarditis, stiff, constrictive pericarditis, or accumulated with fluid, pericardial effusion. These may occur together after a heart attack or may vary due to conditions. Congenital heart disease. Congenital heart disease develops in the womb of the mother before the birth of the baby. Narrowing of the aorta, coarctation, holes in the heart, atrial or ventricular septal defect are some congenital diseases. Detection may be at the time of birth or later in life. Heart failure. Heart failure may occur as a result of other cardiovascular conditions. It is a condition where the heart cannot pump enough blood to the organs and tissues in the body. Due to this, other vital organs do not get enough blood, causing shortness of breath, fluid retention, and fatigue. Congestive heart failure is used if the heart failure has led to a fluid buildup in the body. Blood vessels. These are essentially hollow tubes that carry blood to the organs and tissues. The types of blood vessels are arteries, veins, capillaries, and lymphatic cells. Disorders related to blood vessels that affect the heart are atherosclerosis, arteriosclerosis, hypertension, stroke, ischemic and hemorrhagic, aneurysm, claudication with peripheral arterial disease, vasculitis, venous incompetence, venous thrombosis, varicose veins, and lymphedema. Diagnosis. Diagnosis is based on a series of tests. Simple procedures are listening, stethoscope, to your heart, measuring the heart rate, and the blood pressure. The systolic and diastolic blood pressure are measured and are around 120 and 80 respectively for a normal heart. Blood tests to check for high cholesterol levels. Other tests are CPR testing, which gives the state of inflammation of arteries. ECG and EKG tests are where the electrical activity of the heart is tested to assess blood flow and heart rhythm. It is also done under stress at times to find out related cardiac arrhythmia ailments. X-rays are used to look at the structures of the chest, lungs, and heart to evaluate proper functioning. Head up-tilt test is used to evaluate the causes of fainting spells. Ultrasound/echocardiograms give pictures of the heart chambers and its valves. A few other test methods are cardiac catheterization/coronary angiogram, electrophysiology, electron beam ultrafast CT or EBCT, cardiac biopsy, myocardial biopsy, MRI scan, and pericardiocentesis. It is also important to take a look at high triglycerides, as well as this often accompanies high cholesterol, an acid-sensing ion channel that detects ischemic pain. Ischemic pain occurs when there is insufficient blood flow for the metabolic needs of an organ. The pain of a heart attack is the prototypical example. Multiple compounds released from ischemic muscle likely contribute to this pain by acting on sensory neurons that innervate muscle. One such compound is lactic acid. Here, we show that ASIC3, acid-sensing ion channel number 3, has the appropriate expression pattern and physical properties to be the detector of this lactic acid. In rats, it is expressed only in sensory neurons and then only on a minority, around 40% of these. Nevertheless, it is expressed at extremely high levels on virtually all dorsal root ganglion sensory neurons that innervate the heart. It is extraordinarily sensitive to protons, Hill slope 4, half-activating pH 6.7, allowing it to readily respond to the small changes in extracellular pH, from 7.4 to 7.0, that occur during muscle ischemia. Moreover, both extracellular lactate and extracellular ATP increase the sensitivity of ASIC3 to protons. This final property makes ASIC3 a coincidence detector of 3 molecules that appear during ischemia, thereby allowing it to better detect acidosis caused by ischemia than other forms of systemic acidosis such as hypercapnia. Chapter 4. Ischemic Heart Disease. Ischemia is a decrease in the blood supply to a bodily organ, tissue, or part caused by constriction or obstruction of the blood vessels, and it is the proper medical term for reduced blood flow to the heart. Hardened or blocked arteries are usually the cause of it, and it is the number one cause of death in most Western countries. The growth of these tissues is called arteriosclerosis. Arteriosclerosis typically begins in early adolescence, but is rarely diagnosed until late in life, usually due to a stroke or heart attack. Autopsies of healthy young men who died during the Korean and Vietnam Wars showed evidence of the disease. Early diagnosis and treatment can stop the progression of arteriosclerosis and prevent a medical emergency. According to the United States data for the year 2004, for about 65% of men and 47% of women, the first symptom of arteriosclerosis disease is heart attack or sudden cardiac death, death within 1 hour of onset of the symptom, or the obstruction of arteries supplying the brain result in a stroke. Another problem that can be caused by ischemic heart disease is what is called an aneurysm. It is a localized pathological blood-filled dilation of a blood vessel causing a weakening of the vessel's wall. As plaque builds up in the arteries, it causes an obstruction, and the blood flow around the obstruction puts pressure on the walls of the arteries. This can cause the walls of the arteries to balloon out and become weakened as the blood moves around the obstruction. If one of these balloons or aneurysms explodes, then death can occur within minutes. If the plaque becomes dislodged from the arterial walls, it can travel to the heart and cause one of the blood vessels of the heart to become blocked, causing a heart attack. If the plaque becomes lodged in one of the blood vessels that supply blood to the brain, then it will cause a stroke. Ischemic is caused by a diet that is high in fats and physical inaction. A high-fat diet leads to a high amount of cholesterol in the blood. The American Heart Association provides a set of guidelines for total blood cholesterol levels and risk of heart disease. The desirable LDL level is considered to be less than 100 mg/dl. However, the 1987 report of National Cholesterol Education Program suggests the total blood cholesterol level should be less than 200 mg normal blood cholesterol. If the cholesterol level is between 200 and 239 mg, it is considered borderline high, and higher than 240 mg is considered high cholesterol level. Many scientists, nutritionists, and activists are worried about ischemic heart disease, and they are trying to educate the American population in healthier diets. And this power of healthy suggestion seems to be working on restaurants. Especially since 2004, fast food chains have started to offer healthier menu choices such as yogurt, salads, and fruit. Many restaurants now print some nutrition information on their menus and offer specifically heart-smart recipes. Common vitamins and over-the-counter products can help with ischemic heart disease, such as FODI, niacin, vitamin C, pectin, and EPA. Niacin is the closest thing available to a perfect treatment that corrects most causes of coronary heart disease. Niacin blocks the release of fatty acids from fat cells. Niacin plays a critical role in energy production, gene expression, and hormone synthesis. You cannot live without it. Niacin also tends to shift LDL particle distribution to larger particle size and improve HDL functioning. The intake of 3 grams niacin for as little as 2 weeks can reduce serum cholesterol by 26%. Vitamin C has been shown to combat the development of cholesterol deposits in the arteries. Within a few hours after receiving vitamin C, patients showed a sharp decline in the cholesterol levels of the blood. Pectin limits the amount of cholesterol the body can absorb. High pectin count in apples may be why one a day keeps the doctor away. Studies of Greenland Eskimos' lack of heart attacks have shown that eicosapentaenoic acid, EPA, lowers blood cholesterol considerably, even more than polyunsaturated fat does. It also triggers a major drop in triglycerides. Salmon oil is one of the best-known sources of natural EPA. If you are at risk from heart disease, then find a good healthcare professional prior to starting any type of home treatment. Essential facts about anti-ischemic drug. The anti-ischemic drug trimetazidine preserves the energy metabolism of cells that have been exposed to ischemia or hypoxia. Patients with angina treated with this drug showed increased coronary flow reserve. Doctors prescribed trimetazidine to treat angina pectoris. This anti-ischemic or anti-anginal metabolic drug helps improve myocardial glucose utilization by means of inhibiting fatty acid metabolism. Mechanism of action. Referred by its brand name, Vesteril MR, trimetazidine is available in tablet form in dosage of 35 milligrams. The energy metabolism of cells that are exposed to ischemia or hypoxia can be preserved with the help of this medication, which prevents reduction in levels of intracellular adenosine triphosphate. The use of this drug ensures improved transmembranous sodium-potassium flow and proper functioning of ionic pumps, as well as maintaining cellular homeostasis. It is also known to inhibit oxidation of fatty acid in your blood vessels. Important information. Trimetazidine should be taken with full stomach. It is not recommended to be used by pregnant women, lactating women, or people with hypersensitivity. Adverse drug reactions to this drug include vomiting, nausea, and gastrointestinal disturbances. In some countries, trimetazidine is marketed as treatment for dizziness and tinnitus. This is due to the fact that it has a high tolerability and safety profile with no known drug interactions. Other therapeutic benefits. Trimetazidine is also known for its cardioprotective effects, as confirmed in human ischemia reperfusion. The drug works on patients who are undergoing bypass surgery with cardioplegic arrest and percutaneous coronary artery revascularization. Studies showed that a modified release, MR, form of this medication, if taken twice daily, is bioequivalent to previous formulation, which is taken thrice daily. Meanwhile, controlled studies done on angina patients showed that trimetazidine raises coronary flow reserve, thus controlling rapid swings in blood pressure, significantly decreasing the frequency of angina attacks, leading to reduction in the use of nitrates. For diabetic patients with coronary heart disease, trimetazidine helps improve left ventricular function. Trimetazidine also showed effectiveness in treating patients with heart failure. Consulting your doctor before taking this drug is highly recommended. Ischemic heart disease and the Western world. From the time people are very young, even as young as 5 years old, they can start developing tissue deposits called plaque in the lining of their arteries. For many people, these deposits never cause trouble. For others, they can be a killer. The growth of these tissue deposits is called arteriosclerosis. Ischemic heart disease is the proper medical term for reduced blood flow to the heart. It is ultimately caused by hardened or blocked arteries, and it is the #1 cause of death in most Western countries. These tissue deposits grow, the arteries enlarge to a degree to try and accommodate blood flow. However, if the deposit of plaque ruptures, the particles clog blood passages, causing, in the worst cases, a heart attack or stroke. Give the fats a miss. In Europe and the United States, calories are cheap and plentiful. For an hour's wage, a person can buy a meal containing a pound of meat. However, in some countries, a pound of meat is a treat to be divided within one family once a month. No doctor recommends either extreme or poor or rich food, but rather everyone needs a healthy, balanced, but lean diet to prevent ischemic heart disease. Medical professions and scientists know what causes ischemic heart disease: a fatty diet, inaction, and smoking. While smoking is certainly not limited to rich countries, a fatty diet and inaction are luxuries of middle and upper class populations. Some doctors have an idea about using peer pressure to make Westerners make themselves healthier. 30 years ago, few Americans wore seatbelts and many more smoked cigarettes than now do. The implementation of new laws played a part in changing behavior, but in both of these cases, peer pressure really started the trend. And many scientists, nutritionists, and activists worried about ischemic heart disease are trying to repeat the trend for healthier diets. This power of healthy suggestion seems to be working on restaurants. Especially since 2004, fast food chains have started to offer healthier menu choices such as yogurt, salads, and fruit. Many restaurants now print nutrition information on their menus and offer specifically heart-smart recipes. Transient ischemic attack facts. People are largely getting affected with cardiovascular problems due to the hectic lifestyle. Faulty habits of eating and drinking, disturbed sleep, unhealthy living, excessive stress, and continuous neglection towards health can cause trouble with cardiovascular system of the body. With the improvement in science and technology, we have discovered many diseases that were unknown in the ancient days. Numerous people have faced death due to unawareness and lack of medical facilities. But in this century, we are flourished with ample of technologies that help us to detect the disease. The recent study has mentioned that transient ischemic attack is similar to a stroke, which lasts for a few minutes. This stroke does not cause any permanent damage to your cardiovascular system or any other organ of the body. Generally known as mini stroke in common man's language, TIA is actually a warning sign for future problems. In most of the individuals who suffer from TIA, suffer from a major stroke within a year. In such situation, it is important that you don't get impatient and panic. You need to take this problem with positive attitude. Consider this mini stroke as a sign of warning and a blessed opportunity. Warning for future major stroke and opportunity. Take some strict precautions to prevent from further damage. Transient ischemic attack is caused due to many reasons that are similar to causes of ischemic attack. Ischemic stroke is the result of blood clot that clogs the supply of blood to your brain, while in TIA, the obstruction is not major and thus prevents permanent harm. Excessive deposition of cholesterol, that is known as plaque atherosclerosis, in one of the arteries also leads to stroke. It clogs the supply of nutrients and oxygen to your brain. These plaques reduce the flow of blood via an artery or even form blood clot in the cardiovascular system of the body. Even the shifting of blood clot from heart to brain often leads to TIA. This disease involves certain risks that might lead to severe complications. Some of the risk factors that might cause transient ischemic attack cannot be changed, while some of them can be controlled. The individuals having family history of TIA or stroke are generally at greater risk. If you are aged above 55, then you have a greater chance of getting affected with TIA. Gender matters in this case. Generally, men are at a higher risk of getting stroke, but more of females face death. Black individuals are also at greater risk than that of whites. You can control high blood pressure, smoking cigarettes, diabetes, high cholesterol, lack of physical activity, obesity, intake of birth control pills, and poor habit of eating. Work on these factors to avoid further severe stroke. Chapter 5. The Prevention of Ischemic Heart Disease. Ischemic heart disease occurs when there is a partial blockage of blood flow to the heart. When the heart does not get enough blood, it has to work harder and it becomes starved for oxygen. If the blood flow is completely blocked, then a myocardial infarction, heart attack, occurs. As we age, we naturally have plaque build up in our arteries. This is called arteriosclerosis, which is a hardening of the arteries. This can lead to blood clots that can cause a heart attack or stroke. Hardening of the arteries and blockage of major arteries is one of the leading causes of death by disease in the United States. In fact, heart disease itself kills more people every year than the next 6 diseases combined. The degree to which ischemic heart disease affects each individual depends on a variety of factors, including age, genetics, diet and exercise habits, and smoking. For many people who are at high risk, it is important to make certain lifestyle changes that will reduce this risk. Since medical science and doctors know the cause of ischemic heart disease, they also know the steps to take to prevent or reverse its effects. And the steps one can take to avoid its effects are actually quite simple. Eat a healthy diet and avoid foods high in saturated fat. Get more regular exercise to strengthen the cardiovascular system. Drink alcohol in moderation and stop smoking. By making these types of simple lifestyle changes, you can avoid and prevent the onset of this disease. Saturated fats are one of the leading causes of plaque buildup in the arteries. By avoiding fatty foods that contain these types of fats, you can significantly reduce your risk of heart disease. In fact, if you eat more fish that are high in omega-3 fatty acids, you can significantly reduce the buildup of plaque. Omega-3 help build up the good cholesterol called HDL, which helps remove the bad cholesterol, LDL. Exercise will significantly reduce the risk of ischemic heart disease by helping the body effectively remove excess body fat and reduce the risk posed by obesity. Any form of exercise, whether it's daily walks, working around the yard, or a full-on exercise program, will work wonders when it comes to preventing this condition. The following things are recommended after a heart attack: possible angioplasty or cardiac surgery, possibly the regular administration of anticoagulants to prevent further blood clot complications, possibly the administration of drugs like digoxin, verapamil, and amiodarone. To reduce heart arrhythmias, although they may also induce arrhythmias, a daily intake of aspirin. Lifestyle modifications are important in prevention of a second MI. Increased exercise, reduction of stress, and improved dietary considerations are perhaps most important. Here is some very important advice that you should take into consideration for lowering the risk of a heart attack. Stop smoking, stop eating foods which are high in fat, get some regular exercise, and avoid excessive stress. Avoidance of smoking and secondhand smoke represent a very important measure in avoiding cardiovascular disease. Studies have shown that smokers who quit lower their risk of stroke by 27% 2 years after stopping. Their risk reaches the level of non-smokers after about 4 years. A healthy diet is the strongest protection against cardiovascular disease. A heart-healthy diet is rich in fruits and vegetables and low in saturated fat, cholesterol, meat, and sugar. It isn't necessary to eat perfect, and you don't have to see this as a burden. But you should try to change your diet step by step, giving up the foods rich in fats and lowering your cholesterol level. Most medical experts agree that a high total cholesterol level is a critical risk factor for cardiovascular disease, and that a reduction in overall cholesterol levels is an important measure in preventing and treating atherosclerosis. Finally, and most important, exercise is an important component in the rehabilitation of heart disease patients. Regular exercise helps prevent obesity and diabetes, which are also important risk factors for heart disease. Recurring transient ischemic attack is a warning signal of an impending stroke. In ischemia, tissues do not get enough oxygen because blood flow through vessels that supply those tissues is impeded. Transient ischemic attack in the brain resembles a stroke due to cerebral embolism, but a transient ischemic attack differs in that the symptoms last for only a short time. A sudden onset of weakness and numbness down one side of the body, for example, may last a few minutes or hours and then disappear, whereas the symptoms of a stroke last for more than 24 hours. It is important to understand this difference. Transient ischemic attacks are often signals of an impending stroke. Therefore, they should be treated to attempt to avoid a stroke that may occur later and cause more serious damage. The narrowing or obstruction of arteries to the brain can be caused by several factors. Most often, however, an ischemic attack occurs because a small clot or a piece of plaque breaks away from the wall of an artery or heart valve and is carried into the brain. As the fragment of clot or plaque, called an embolus, passes through blood vessels in the brain, it temporarily impedes the flow to an area of brain tissue and causes stroke-like symptoms. The exact symptoms will vary depending primarily on the portion of the brain affected. Circulation may soon be restored, however, and the temporarily deprived tissue soon recover. The block is therefore transient or short-lived, but the problem is likely to recur. The symptoms are like those of a stroke, but they do not last long. They may include headaches, dizziness, tingling, numbness, blurred or double vision, confusion, or loss of the use of part of one side of the body. If the embolus makes its way into an artery that supplies an eye, there may be temporary blindness in that eye. Recurring transient ischemic attacks often warn of an impending stroke. Nearly half of those who have transient ischemic attacks are apt to have a stroke within 5 years after they have their first attack. If you have had stroke-like symptoms or sudden loss of vision in one eye, do not delay in consulting your physician, who may, after examining you, refer you to a neurologist. The first diagnostic step will be to try to identify the source of a possible embolus. A likely source of emboli is one of the 2 carotid arteries in your neck. To search for signs of narrowing of the carotid arteries, your physician may listen with a stethoscope to various places in your neck. The stethoscope may also be placed on your chest to pick up any sounds of an abnormal heart valve or irregularity in heartbeat rhythm. You may then need to have an electrocardiogram, ECG, a chest X-ray, other scanning tests such as ultrasound of the carotid arteries, and special X-rays called arteriograms of those blood vessels that may be the source of the problem. The purpose of treatment is to try to prevent a stroke. What preventative measures are used depend mainly on your age and general state of health. Medical treatment may consist simply of a blood thinner, such as aspirin, to reduce the likelihood of blood clot formation. Lifestyle modification to control risk factors will be advised. If the precise location of the narrowing of an artery has been identified, the atheroma or fatty deposit causing the narrowing may be removed by a surgery called carotid endarterectomy to improve the blood flow. Save your life. 3 tips to prevent ischemic heart disease. Ischemic heart disease is a step along the road to a heart attack and possibly either death or dangerous heart bypass surgery. The good news is this type of heart disease can be almost wholly prevented. Here's how. First, what is ischemic heart disease? It happens when you have a partial blockage of blood flow to your heart. You see, when your heart doesn't get the blood it needs, it's not getting enough oxygen. If it's not getting enough oxygen, it has to work harder. If it has to work harder, you get the picture. Heart failure is a very real possibility. Tip 1. Plaque attack. Plaque buildup signals the faint beginnings of this type of heart problem. As we get older, sludge, plaque, builds up in our arteries. Know what you're eating. You can help stop the sludge by cutting out, or at the very least cutting way down, the junk food and concentrating on fresh fruits, veggies, and lean meats, poultry and fish included, for your diet. Tip 2. Don't let your life go up in a puff of smoke. If you smoke, quit. Plain and simple. Having said that, I know it's not a simple thing to kick the habit. I saw what my husband went through. At the very least, you can cut down. Take it day by day, week by week, until you're off. Smoking takes oxygen away from your lungs and introduces carcinogens into your body. Not good things if you're at risk for heart problems. Tip 3. Get moving. Yep, you knew it was coming. You need exercise. But keep in mind that exercise doesn't mean you have to hate every second. It means just get up and move. Walking, working out at the gym, or just dancing around your living room all qualify. Do what you enjoy, and it's a whole lot easier to do it regularly. Small steps can prevent heart disease. You don't necessarily have to change your whole life at once, unless you have a mandate from your doctor. Cerebrospinal disease, transient ischemic attacks, and ischemic stroke. Disorders of the central nervous system secondary to pathological processes involving the blood vessels are very common above the 5th decade of life. Any sudden non-convulsive focal neurological deficit can be referred to as a stroke. Vascular disorders are characterized generally by their abrupt onset. Strokes are broadly divided into ischemic and hemorrhagic lesions. Cerebrospinal diseases, transient ischemic attacks, and ischemic stroke. Disorders of the central nervous system secondary to pathological processes involving the blood vessels are very common above the 5th decade of life. Any sudden non-convulsive focal neurological deficit can be referred to as a stroke. Vascular disorders are characterized generally by their abrupt onset. Strokes are broadly divided into ischemic and hemorrhagic lesions. When the arterial supply to the brain is interfered with, ischemic necrosis and infarction develop. Obstruction of an artery may be either by a thrombus or an embolus. Sometimes gross impairment of the cerebral circulation due to hypotension produced by cardiac failure or shock may also lead to cerebral ischemia. The location and size of the infarct or hemorrhage determine the neurological deficit. Hemiplegia is the commonest mode of presentation. The course of development of neurological events often gives the clue to the type of stroke. In cerebral embolism, the deficit starts all of a sudden, reaching its peak within minutes. Cerebral thrombosis also has an abrupt onset, but it evolves slowly over a period of several minutes, hours, or days in a series of steps rather than in a smooth course. In cerebral hemorrhage, the deficit starts from its moment of onset and steadily progresses over a period of minutes or hours. Though these patterns are recognizable in the majority of cases, considerable overlap occurs so that the clinical events may be misleading at the time. Chapter 6. What is ischemic stroke? Ischemic stroke is a type of brain stroke. This brain stroke is commonly known as CVA, or cerebrovascular accident. Along with the other type of stroke, ischemic stroke is also considered fatal. The mere fact that it involves the brain makes the condition detrimental without even going into the details of the disease. The brain is a vital organ which controls all other parts of the body. Any disruptions to its function will greatly affect the capabilities of a person. Even when someone is sleeping, the brain is one of the few organs in our body that is still functioning. Ischemic stroke is always preceded by a TIA stroke, or transient ischemic attack. It can be considered as a warning sign of a stroke. This can be possible if there's a short cessation in blood and oxygen supply to the brain. When the nuisance in the system is not recognized earlier and prompt treatment is not performed, it may cause ischemic stroke to occur in that person. In this condition, the supply of oxygen through blood is occluded by a thrombus or an embolus. Thrombus is the formation of blood clots in the blood vessel that can eventually occlude it. Thus, as soon as this thrombus is detached from its original location, it travels into the bloodstream. In this situation, the thrombus is now termed as an embolus. It is considered as an emergency situation for the medical team because there is an ischemia in the selected brain tissue or a deprivation of oxygen supply to the brain. After 6 minutes of ischemia, the patient might have permanent damage in the brain. Subsequent to 10 minutes of oxygen deprivation, the patient may have dead brain tissues. The death of the patient may be imminent with this condition. The symptoms of stroke may vary from each other. This is due to the damage that the condition has resulted in. The damage in the brain of a patient is parallel to the symptoms that he or she will manifest. Patients with this condition may have motor deficits, visual disruptions, sensory dysfunctions, cognitive deficiencies, verbal deficits, and emotional problems. Since the patient has a vast number of manifestations, caring for this type of patient will entail a multifaceted approach to address each disability that the patient may possess. Diagnostic exams are prerequisite in the provision of treatments. First of all, it is necessary to rule out other conditions. The diagnostic tests that are involved in ischemic stroke are mostly focused on getting images of the brain and other structures, such as blood vessels, that can contribute to the occurrence of the stroke. Lifestyle changes may be necessary, especially for persons who have a higher risk of getting the disease. There are some populations that have a higher risk than others. These people include obese people, persons with hypertension, and patients with hyperlipidemia. The prevention of ischemic stroke consists of pharmacologic interventions, lifestyle changes, and surgical procedures. These mentioned procedures are also applicable in the treatment of this condition. It also includes therapies which can improve the situation of the patient, such as physical therapy, speech lessons, emotional support, and cognitive therapy. Interventions should be performed as soon as possible to prevent greater damage to the patient. The net effect of arterial occlusion on the cerebral tissue depends on the available amount of collateral blood flow to the affected zone. The circle of Willis normally provides adequate blood flow in the event of occlusion of any vessel proximal to it. If the occlusion is in the internal carotid artery, there may be a retrograde anastomotic flow from the external carotid artery through the ophthalmic artery. In addition to the patency of the collateral vessels, the speed of the occlusion also influences the collateral supply. Gradual narrowing of a vessel allows time for collateral channels to open up. Presence of hypotension or hypoxia at the critical moment may render the anastomotic channel ineffective. Risk factors. Several factors predisposes to the development of ischemic stroke. Hypertension is perhaps the most important risk factor both for cerebral infarction and intracerebral hemorrhage. Both systolic and diastolic pressures play a role. Diabetes mellitus is an important predisposing factor which hastens the atherosclerotic process in both small and large arteries. Other factors such as smoking, obesity, hyperlipidemia, polycythemia, and the use of oral contraceptives in women are known to increase the risk. Embolic stroke are usually secondary to cardiac disorders such as valvular disease, ischemic heart disease, ineffective endocarditis, congenital lesions, and arrhythmias, especially arterial fibrillation. In atherosclerosis, affecting the extracranial course of the internal carotid and vertebral arteries, platelet thrombi and atheromatous plaque may get detached to be embolized. Management of ischemic stroke. The prevention of stroke assumes great importance since there is no known therapeutic method which can fully reverse the established infarct. In the acute stage, the aim is to ensure adequate cerebral perfusion and avoid all factors that interfere with cerebral blood flow. The patient is nursed in the recumbent posture, carefully avoiding the upright posture. Coexistent disorders like anemia of polycythemia should be corrected. Antihypertensives are administered if the diastolic blood pressure is above 110 millimeters of mercury. A short course of dexamethasone is given parenterally in a dose of 4 milligrams, 6 hours. It is useful in reducing the brain edema. The use of anticoagulants is controversial, since in the majority of patients distinction between ischemic and hemorrhagic stroke is clinically impossible. Anticoagulants have no role in completed stroke. It is important to exclude intracranial hemorrhage, preferably by CT scan, or at least by CSF examination before starting anticoagulants. Absence of erythrocytes in the CSF almost excluded cerebral hemorrhage. Hypertension is not a serious contraindication. Anticoagulants are considered in patients with recurrent TIAs or stroke in evolution so as to arrest further thrombosis. When embolism is evident, these drugs are clearly indicated. The usual way is to start Hairpin 5,000 units 4 hours for 1 to 2 weeks, and after that, replace it by oral anticoagulants like Coumadin for 8 to 16 weeks. Antiplatelet drugs have shown a lot of promise in preventing thrombotic attacks. Aspirin, 150 milligrams, given as a single dose daily, inhibits platelet aggression. Dipyridamole, 75 milligrams thrice a day, given orally, is also similarly effective. Antiplatelet drugs are of special value in preventing the progression of carotid TIAs. Surgical treatment. Whenever recurrent TIAs are associated with demonstrable stenosis due to atheroma and ulcerating plaques in the neck vessels or the arch of aorta, surgical intervention is indicated. Thromboendarterectomy, or bypass graft of the carotid, innominate or subclavian arteries have been beneficial in controlling the TIA. In completed strokes, drug therapy is of little avail. Physiotherapy is started early to facilitate movement and rehabilitation. Early ambulation is advocated since this helps in avoiding the development of contractures, periarthritis, and bedsores. Transient ischemic attack, Ayurvedic herbal treatment. A transient ischemic attack, TIA, is a temporary or intermittent neurological event which usually lasts for a few minutes and leaves no permanent effects. Common symptoms include sudden weakness, numbness, or paralysis of the limbs, slurred speech, blindness or double vision, dizziness, and a loss of balance or coordination. Symptoms usually last for less than 24 hours. TIA is usually a sign of an impending stroke. The Ayurvedic treatment of TIA is aimed at controlling the risk factors for this condition and preventing a full-fledged stroke. Ayurvedic medicines may be given in combination with modern medicines to control the blood pressure and reduce blood clots. Medicines like Yograj Gugalu, Triphala Gugalu, Medohar Gugalu, Panchtitka Grut Gugalu, Punarnavadi Gwada, Chitrakadi Vati, Arogya Vardini, and Chandrapahavati are used to reduce atherosclerosis in the arteries and thus reduce the risk of stroke. Herbal medicines which can be used for this condition include Gugalu, Commiphora mucul, Psyllium, Pentago ovata, Lashuna, Allium sativum, Kutki, Picoritza cura, Amalaki, Emblica officinalis, Haritaki, Terminalia chibula, Bahada, Terminalia bellarica, Sunti, Zinsieber officinalis, Marik, Piper nigrum, Pepali, Piper longum, Chavia, Piper rectofractum, and Chitka, Plumbago zelentia. Medicines which act on the Ras, Ratka, and Meta dahatis tissues can also be used for this purpose. These medicines include Kutaj, Haloharina antidicentrica, Patol, Trichosanthe dioica, Sariva, Hemidesmus indicus, Patha, Sesampelus pariah, Musta, Cyprus rotundus, Chirata, Suerta chirata, Guduchi, Tinospora cordifolia, and Racta chandan, Pterocarpus santalinus. It is also important to treat the risk factors which can cause stroke in patients affected with TIA. High blood pressure can be treated using medicines like Serpinganda, Rauwolfia serpentina, Sutchekaras, Pravalbasma, and Damasa, Vagoina cretica. Cardiovascular disease can be treated using medicines like Laxmi-Vilas Ras, Shrangbasma, Arjanarishta, Dashmularishta, Abrak Basma, and Mahalaxmi Vilaras. Diabetes can be controlled using medicines like Amalaki, Haridra, Curcuma longa, Mamejva, and Ecostema laterali, Gudmar, Gymnema sylvester, Nimba, Azadirachata indica, Carabalaca, Mormadica charantia. Blood disorders and migraine can be treated using medicines like Panchtika Grutguglu, Maha Manjishtad Quada, Saravidi Churna, and Pathyadi Quada. It is important for all people affected with TIA to adopt a healthy lifestyle and to avoid the known risk factors related to this condition. Regular exercise, eating plenty of fruits and vegetables, maintaining a healthy weight, controlling diabetes, and cessation of smoking are recommended. Treating hypoxic ischemic encephalopathy with umbilical cord blood cells. Stem cell therapies have been applied to treat many serious diseases successfully. One of these diseases is hypoxic ischemic encephalopathy. Hypoxic ischemic encephalopathy is mainly caused by oxygen deprivation, which leads to brain damage in children. This disease is often associated with several motor impairment and cognitive and development disruption during the development period of a child. However, a Duke University Medical Center study had shown that stem cell therapy could be beneficial for children with hypoxic ischemic encephalopathy. The Duke University research was a pilot study to determine if umbilical cord blood stem cells could improve the condition of the infant born with symptoms of brain damage. The process must be conducted within the first 14 days after the baby is born. The cord blood was collected from the baby's own umbilical cord. The primary objective of the research was to see if stem cells could provide a concrete treatment to this condition. Secondly, the scientists would also want to see if the infusion resulted in neurodevelopmental benefits. The study was launched with 52 children with signs of brain damage in January 2008. It took 9 years to complete phase 1 of the study. Let's dig deeper into the research. The infants who were enrolled in the study were in the first 14 postnatal days, and all of them had diagnosed with moderate to severe hypoxic ischemic encephalopathy. More importantly, all of them have their own umbilical cord blood stored during birth. Infants who met all these criteria received 4 infusions of their own umbilical cord blood stem cells. The dose was determined by the quantity of cord blood available for the babies. However, the dose of each infusion was 5 by 10 E7 cells per kilogram. The babies gone through follow-up checkups after 4 to 6 and 9 to 12 months. However, the dose of each infusion was 5 times 10 to the power of 7 cells per kilogram. The babies gone through follow-up checkups after 4 to 6 and 9 to 12 months. Their MRIs showed significant development. Another study on the similar subject was published in PubMed and CBI. This study was also based on autologous umbilical cord blood stem cells to treat hypoxic ischemic encephalopathy. Children with severe to moderate hypoxic ischemic encephalopathy were enrolled for this research. All of them had received an autologous umbilical cord blood stem cells. They were given 4 doses of infusion. The team monitored cell infusion characteristics, UCB collection, and pre- and post-infusion differences. They also compared the hospital outcomes with children who did not have available stem cells. After 4 doses of 4.3 milliliters infusions, the children were examined in order to monitor vital signs. One of the main signs, oxygen deprivation, was noticed to be the same pre- and post-infusion in the first 48 hours. However, the outcome showed significant improvement with a score of greater than 85 later. So, it's shown that critical diseases like hypoxic ischemic encephalopathy can be treated with umbilical cord blood stem cells. However, there are certain conditions to be fit for the therapy. First of all, your child must have stem cells available for the infusion. So, as a parent, you must consider cord blood banking before your child is born. We sincerely wish you have a healthy pregnancy and a healthy baby. But if something goes wrong, you will always be prepared to tackle that hurdle. Chapter 7. Mini-strokes or TIAs, Transient Ischemic Attack. TIA or transient ischemic attack can be described as a mini-stroke. While a TIA does not necessarily cause serious damage to the brain, it is a serious brain assault. TIAs look just like a regular stroke, except that the symptoms disappear in less than 24 hours, and many times the symptoms last less than 1 hour. These mini-strokes take place when the blood flow to the brain is temporarily interrupted. Most TIAs are due to a blood clot which frees itself or dissolves before permanent brain damage can occur. Left untreated, the possibility of suffering a full-blown stroke increases by over 80%. Some of the symptoms to look for are numbness, tingling, or heaviness to the face or limbs, unable to move arms, legs, or face, especially on the side of the body, double vision, blurriness, or unable to see out of one eye, difficulty in speaking, unsteady, dizzy, or loss of balance. Again, these symptoms can last less than an hour, and many times we dismiss these occurrences as to being tired, under stress, or fatigued. If you experience any of these warning signs, see your physician immediately. Stroke is the 3rd leading cause of death, right behind heart attacks and cancer. High blood pressure is the leading cause for strokes. To reduce your risk factors, control your blood pressure, watch your cholesterol levels, eat healthy, exercise, and if you smoke, ask your doctor for programs that can assist you in quitting. Know the warning signs and get medical care immediately. Time is a major factor, whether it is a transient ischemic attack or a major stroke. Stroke, brain attack, ischemic stroke. Stroke is caused by uncontrolled diet that is high in saturated and trans fat as a result of bad cholesterol building up in the blood vessels that block the circulation of blood to the body, including the brain. If oxygen is not delivered to the brain cells, some cells die off and cannot reproduce. Then you may have a stroke. Other strokes happen when a blood vessel in the brain ruptures, causing the cells in your brain to be deprived of oxygen. In this article, we will discuss ischemic stroke in great details since 80% of all strokes are ischemic. A stroke occurs when there's a problem with the amount of blood in your brain. The cause of ischemic stroke is that there is too little blood in the brain. They occur when the arteries to your brain are narrowed or blocked, causing severely reduced blood flow, ischemia. This deprives your brain cells of oxygen and nutrients, and cells may begin to die within minutes. The most common ischemic strokes are thrombotic stroke. These strokes are also something referred to as large artery strokes. The process leading to thrombotic stroke is complex and occurs over time. Thrombotic stroke might be caused by arterial walls slowly thickening and hardening as a result of arteries being injured. Such injuries signal the immune system to release white blood cells to the site causing stroke. Thrombotic stroke also occurs when the inner wall of arteries were injured in result of less nitric oxide being produced, causing the hardening of the arteries. If the blood clot then blocks the already narrowed artery and shuts off oxygen to part of the brain, we have a thrombotic stroke. Embolic stroke. An embolic stroke occurs when a blood clot or other particle forms in a blood vessel away from your brain. It is usually caused by a dislodged blood clot that has traveled through the blood vessels until it becomes wedged in an artery. It is also caused by irregular beating in the heart's two upper chambers. This abnormal heart rhythm can lead to poor blood flow and the formation of a blood clot. The role of life insurance in coronary heart disease. Ischemic heart disease. Coronary heart disease, ischemic heart disease, and the roles that life insurance and income protection plays in the management of these diseases. Cardiovascular diseases are significant health concerns in an aging population and can have important ramifications for families. Life insurance and income protection play an important part in protecting the lifestyles of older Australians. 33% of Australian women over 55 years of age are at a high to extreme risk of experiencing coronary heart disease. Men are slightly more at risk. Ischemic heart disease and coronary heart disease. Ischemic heart disease, more commonly known as coronary heart disease, normally manifests itself in people of middle age, living sedentary lifestyles. This disease is a hardening of the arteries caused by the prolonged consumption of fatty foods over many years. As fats and other substances gradually deposit on the artery walls near the heart, they constrict the flow of blood to and from the heart. Potential sufferers will over time begin experiencing difficulty undertaking moderate to heavy exercise. They may experience shortness of breath, as well as more immediate symptoms such as pain in the arms, neck, back, and chest areas. This affliction has become one of the major causes of death in middle age. Sedentary lifestyles, perhaps coupled with stressful occupations and an abundance of foods containing saturated fat and trans fat, have conspired to significantly predispose many middle-aged and older people to coronary heart disease. Many of the dangerous fats people should avoid are found in processed and takeaway food, which is forming an increasing proportion of the diets of people in affluent countries. Life insurance. Life insurance is one of the products that people seldom pay much attention to whilst they are in good health. As coronary heart disease is an affliction that normally has an onset in middle age, few people associate the necessity to have life insurance with these range of ailments. Living with this condition can have a major impact upon the ability of a person to work, as well as their lifestyle generally. Once a person has a heart condition, they will have to make drastic changes to their way of life, if they have been fortunate enough to survive the initial attack. For example, people who prior to the heart attack worked in stressful occupations, or those requiring some degree of strenuous exercise, can expect to be affected almost immediately. Stress and strenuous exercise are to be avoided once a heart condition is diagnosed. As the onset of coronary heart disease is usually sudden and has the potential to be fatal if the treatment is not available immediately, the families involved will be faced with a sudden and unplanned upheaval to their lives. Life insurance has the potential to mitigate the effects of such sudden traumatic incidents. Life insurance taken up early in life will be cost-effective and affordable. Delaying until middle age will be less cost-effective as actuaries factor the increased probability of coronary heart disease into the premiums payable. Income protection. Income protection is a useful product for people to take up whilst still in the workforce. Living with coronary heart disease will force people to make drastic changes to their lifestyles and potentially their occupations. Heart attack victims will have to avoid occupations that are stressful or involve strenuous physical activity. Occupations like these have the potential to trigger another attack. Income protection softens the blow to the family budget when the individual is unable to re-enter the workforce for a period of time due to the extended convalescence required when recovering from a heart attack. During convalescence, other unpaid duties the person would normally have performed may need to be outsourced as well. Income protection insurance reduces the financial impact of coronary heart disease on individuals and their families. Heart disease and stroke. Are the risk factors the same? Heart disease is a term compelling a variety of heart-related problems. The most common ones are coronary heart disease, caused by accumulation of plaques in the arteries that supply the myocardium; ischemic heart disease, when the heart doesn't receive enough blood; hypertensive heart disease, caused by high blood pressure; inflammatory heart disease that involves inflammation of the heart muscle; valvular heart disease affects the valves of the heart. Many people suffer from some kind of heart disease without even realizing it. This is due to the fact that some symptoms appear later in life. There is a well-known correlation between heart disease and stroke. The first reason why are the common risk factors. Diabetes increases the blood pressure, helps the development of atherosclerosis, and is a significant risk factor for both stroke and heart disease. High blood cholesterol. High levels of blood cholesterol is a major factor for stroke and heart disease. It can lead to buildup of plaques inside blood vessels, which leads to narrowing them. This prevents normal blood flow through your heart and your body, putting you at increased risk. Overweight and obesity. An unhealthy diet, especially one rich in salt and fats, the lack of exercise lead to weight problems and obesity. On their turn, they lead to high blood pressure, high cholesterol, and increased risk of stroke. Smoking and alcohol abuse. These are lifestyle-connected risk factors common for stroke and heart disease. Smoking, as well as exposure to secondhand smoke, contributes to the buildup of plaque in your arteries, increases the risk of blood clots, reduces the oxygen in your blood, increases your blood pressure, and makes your heart to work harder. Smoking also nearly doubles the risk of ischemic stroke. Excessive use of alcohol increases the blood pressure. Birth control pills, pregnancy, and menopause are unique risk factors for stroke and heart disease to women. Oral contraceptives increase the risk of high blood pressure and blood clots, especially if you smoke, already have high blood pressure, or a blood clotting problem. Pregnancy may lead to heart disease or stroke if specific conditions occur, such as preeclampsia, or when there is pre-existing blood vessel malformation. Some women develop diabetes during their pregnancy. Menopause brings a period of life with increased risk of stroke, mainly because of the lack of the hormone estrogen that contributes to the healthy cardiovascular system. Apart from these risk factors, there are some more such as age, gender, family history, and race. Their influence is the same when it comes to heart disease and stroke. Chapter 8. Ischemic cardiomyopathy. Symptoms, causes, and treatment. What is ischemic cardiomyopathy? Ischemic cardiomyopathy, IC, is a condition when your heart muscle is weakened as a result of a heart attack or coronary artery disease. In coronary artery disease, the arteries that supply blood to your heart muscle become narrowed. This can keep necessary blood from reaching portions of your heart muscle, causing damage. If you develop IC, the left ventricle in your heart will likely become enlarged, dilated, and weakened. This inhibits your heart's ability to properly pump blood, which can lead to heart failure. Your doctor's prescribed treatment plan will take into account how much damage your heart has sustained while aiming to treat the underlying cause of your IC to prevent further disease progression, to help improve your cardiovascular function, and to treat any associated symptoms. A combination of lifestyle changes, medications, surgery, or other procedures may be recommended. Healthy lifestyle choices can help lower your risk of complications and reduce your chances of developing IC in the first place. What are the symptoms of ischemic cardiomyopathy? It's possible to have early-stage heart disease with no symptoms. If blood flow becomes impaired due to coronary artery disease, you may experience extreme fatigue, shortness of breath, dizziness, lightheadedness, fainting, chest pain, pressure, known as angina, heart palpitations, swelling in your legs and feet, known as edema, swelling in your abdomen, cough or congestion caused by fluid in your lungs, difficulty sleeping, and weight gain. If you develop these symptoms, seek medical care immediately. What causes ischemic cardiomyopathy? IC is typically caused by a heart attack or coronary artery disease. Risk factors for these conditions include family history of coronary heart disease, high blood pressure, also known as hypertension, high cholesterol, obesity, diabetes mellitus, end-stage kidney disease, amyloidosis, a condition in which abnormal proteins build up in your tissues and organs, including blood vessels, sedentary lifestyle, history of smoking tobacco, and alcohol or drug abuse. You're more likely to develop coronary artery disease if you're a man. But after women reach menopause, the gap between the two genders tends to close. If you're a woman over the age of 35 who takes oral contraceptives and smokes tobacco, you're also at a higher risk. How is ischemic cardiomyopathy diagnosed? If your doctor suspects you have IC, expect to be referred to a heart specialist, also known as cardiologist. They will take your medical history and perform a physical examination, and they likely will order further tests to develop their diagnosis. For example, they may order blood tests to measure the level of cholesterols and triglycerides in your blood, imaging tests such as an X-ray, CT scan, or MRI, an echocardiogram to evaluate your heart anatomy and function using ultrasound waves, an electrocardiogram, ECG or EKG, to record electrical activity in your heart, a stress test to monitor your heart's ability when it's made to work harder, cardiac catheterization, in which a coronary angiogram is done to check for narrowing inside your arteries, myocardial biopsy to collect and analyze a small tissue sample from your heart muscle. How is ischemic cardiomyopathy treated? Your doctor must first address the underlying cause of your IC in order to treat it. Most often, the culprit is coronary artery disease. Doctors may recommend a combination of lifestyle changes, medications, surgery, or other procedures. Lifestyle changes. To help treat coronary artery disease and lower your risk of complications, eat a healthy diet that's low in saturated fat, cholesterol, and sodium. You'll also be advised to exercise in a way that is safe for your condition. If you smoke, your doctor will probably advise you to quit. Avoiding drugs and drinking less alcohol is also likely in order. Don't approach these lifestyle changes as short-term fixes. Rather, commit to developing long-term healthy habits. Medications. Your doctor may prescribe medications to help ease symptoms, prevent complications, and improve your heart function. Depending on your circumstances, they may prescribe a beta blocker to reduce your blood pressure and heart rate, a calcium channel blocker to relax and widen your arteries and lower your blood pressure, an aldosterone inhibitor to lower your blood pressure and rid your body of excess fluid to help ease symptoms such as swelling and shortness of breath, other types of diuretics to rid your body of excess fluid, lower your blood pressure, and reduce the amount of work your heart muscle has to do, other medication therapy to control your heart rate and rhythm, a blood thinner, a medication to treat high cholesterol, surgery, and other procedures. Your doctor may also recommend surgery or other procedures involving your coronary arteries or other parts of your heart. For example, they may recommend implantation of a pacemaker, defibrillator, or both to improve your heart's electrical function, atherectomy to remove plaque from your arteries, balloon angioplasty to help improve blood flow in narrowed arteries, insertion of a stent, a device designed to hold arteries open, radiation therapy after the lumen in a prior placed arterial stent repeatedly narrows, to try to keep your artery lumen from narrowing again. In very serious cases, your doctor may recommend a coronary artery bypass graft, CABG. During this open chest surgery, your surgeon will remove a portion of a healthy blood vessel from another part of your body and reattach it to your heart to restore arterial blood supply. This allows blood to bypass the segment of blocked artery, flowing through the new blood vessel and connecting to the coronary artery downstream from the segments of blockage. If the damage to your heart is too great to repair, you may need a heart transplant. What is the outlook for ischemic cardiomyopathy? If left untreated, IC can lead to blood clots, heart failure, and even death. It's critical to treat the underlying cause of your IC to prevent complications. Your long-term outlook will depend on several factors, including how much damage your heart has sustained, the effectiveness of your treatment, your lifestyle choices. You're more likely to develop complications if you make high-risk lifestyle choices, such as smoking tobacco or misusing alcohol, fail to take your medications properly, don't seek appropriate follow-up care, develop an infection, or have other major health conditions. Ask your doctor for more information about your condition, treatment, plan, and outlook. Can ischemic cardiomyopathy be prevented? You can decrease your chances of developing heart rate disease in the first place by making smart lifestyle choices. For example, monitor your blood pressure and cholesterol levels. Eat a healthy diet that's low in saturated fat, cholesterol, and sodium. Exercise at least 30 minutes of aerobic exercise 5 times a week. Maintain a healthy weight. Don't smoke tobacco or abuse drugs. By practicing heart-healthy habits, you can lower your risk of developing coronary artery disease, ischemic cardiomyopathy, and other cardiovascular conditions. If you've already developed heart disease, healthy lifestyle choices can help mitigate complications. Conclusion. Although we would all like to avoid the possibility of succumbing to this ailment, and many of us live with the conviction that heart disease only happens to others, the reality of our modern lives is that there are many pressures, both subtle and obvious, that predisposes people to this disease. A long-term, healthy diet which minimizes the exposure to saturated fats and the other foodstuffs that's predisposing people to clogging of the arteries is an obvious first line of defense. A long-term, healthy diet which minimizes exposure to saturated fats and the other foodstuffs that predispose people to clogging of the arteries is an obvious first line of defense. Replacing saturated fats with polyunsaturated fats, such as soybean, corn, and safflower oils, as well as salmon, mackerel, trout, and herring, are reputed to reduce the risk of heart attack. Walnuts and sunflower seeds also fall into this category. Monosaturated fats are a healthier alternative to saturated fat. This type of fat can be found in olive oil, macadamia nuts, almonds, peanuts, and avocados. Consuming alcohol in moderation and avoiding tobacco have also been found to be important factors in reducing the risk of coronary heart disease. Regular blood pressure checks and using appropriate blood pressure medication to maintain your blood pressure in an appropriate range for age is vital. Other risk factors that can predispose an individual to an increased risk of coronary heart disease are high levels of cholesterol, obesity, postmenopausal women, and family history. Lifestyle initiatives supported by an appropriate life insurance policy which protects families of heart attack victims and an income protection plan to ease the reduction in income due to the prolonged convalescence a person will face after a heart attack provides the best way of mitigating the trauma associated with coronary heart disease. Thanks again for buying my book. If you have a minute, please leave a review. I take reviews seriously and always look at them. This way, you are helping me provide you better content that you will love in the future. A review doesn't have to be long, just 1 or 2 sentences and a number of stars you find appropriate. Hopefully 5, of course. Also, if I think your review is useful, I will mark it as helpful. This will help you become more known on Amazon as a decent reviewer and will ensure that more authors will contact you with free ebooks in the future. This is how we can help each other. Disclaimer: this information is provided as is. The author, publishers, and/or marketers of this information disclaim any loss or liability, either directly or indirectly as a consequence of applying the information presented herein, or in regard to the use and application of said information. No guarantee is given, either expressed or implied, in regard to the merchantability, accuracy, or acceptability of the information. The pages within this ebook have been copyrighted.